Good afternoon. A few moments ago, I signed the long-term care legislation that was sent to me by the legislature last night. And by pausing and improving this important program, we've really made progress here just in the last few days in Olympia. We do have to get this right because this is so important to so many people. We know that 7 in 10 Washingtonians over the age of 65 will need long-term care. And this bill, new improved bill, is a really important piece in their life plans. You know, so many Washingtonians have experienced the need for long-term care in ways that you really don't sometimes expect it. I heard a story about a woman named Danielle in Asotin County the other day. She's a mom of a 2-year-old who had a spinal cord injury and now is going to be using a wheelchair during her lifetime. And it really hit me because this came out of the blue for her. She never anticipated needing a wheelchair ramp, never anticipated necessary supports, but she sure needs them now. And so this long-term care bill is a really important piece of what we're doing in Washington to make sure everyone can thrive and be healthy. And I'm glad legislators, in a very rapid way, have made improvements to the bill. There were concerns raised in the bill about those who were going to retire within 10 years, those who live outside of the state of Washington. And the legislature fixed those concerns. So good news coming out of here. This has been fixed. It's a solid program, and we look forward to get it going. And I want to thank the legislators for doing this right away during the session so that Washingtonians could have clarity on this. I want to thank leadership for moving this bill quickly. Now, I've got plenty more work to do, and one of the things I believe we should do is to stand up for democracy. And right now, our democracy is threatened. It is threatened by a persistent, repeated effort to spread lies and deception about our election results. It resulted in an insurgency on January 6th and loss of life in Washington, D.C. It has resulted in violence in our state. And it is not just our past, it is our future, unless we stand up against the big lie. And the big lie was that Joe Biden did not win the presidency. And that big lie threatens democracy in our country and our state. We cannot allow reckless, malicious lies to damage the integrity and the confidence of Washingtonians in our democracy. So we're making a proposal that will be heard tomorrow that will say it is unacceptable in the state of Washington to knowingly lie about an election result by candidates and elected officials. It is unacceptable when those knowing lies in fact cause violence or damage the basic fabric of our democracy. I have been working with Senators Frock and Cooter to craft a bill that's very finely crafted to comply with our free speech guarantees of our Constitution. We've been working with some really national experts, Lawrence Tribe, a constitutional law scholar at Harvard, Catherine Ross of George Washington University, to finally craft a bill, and we have done so. You'll hear from them tomorrow. There will be another version of this bill filed tomorrow. It is very carefully crafted to make sure that we do everything we can to comply with our constitutional guarantees of free speech. But without democracy, we do not have free speech. And we do not say it is free to lie on your taxes. You are not free to lie in your Security Exchange Commission reports. And you should not be able to knowingly lie about who won an election. It is a cancer on our democracy, and we must stand against it. This bill is a good faith effort to remedy that problem. Now, how we decide whether it was a violation or not, we do it the American way, which is a jury system. Today, if you are accused of knowingly lying on your taxes, you are judged by a jury. And that is the same guarantee of our Constitution that we would provide to those people who may have knowingly lied about an election result. And I should reiterate, this is only about knowing lies. You would run afoul of this only if you knew you were lying. And it would be up to the prosecution to show that you knew that. So we think it's a good bill. We'll have more discussion about it tomorrow. I want to thank these two constitutional law experts who are free speech experts about the wisdom of this bill. If I can address our COVID situation. As you know, we are hopeful that we will see a plateauing and soon, hopefully, decline of these cases across the state of Washington. We've seen an explosion of that, of course. The latest modeling suggests that that may have already occurred in Western Washington, but east of the Cascades, we would expect to see a continued rapid increase in these cases. We're doing everything we can to help our overburdened hospitals. The National Guard is now on duty in the hospitals, and we're doing everything we can to help hospitals, including getting them a contract for additional personnel and increasing long-term care facilities so we can move people out of hospitals into long-term care. We hope that we will experience what other countries have experienced, that we will see a rapid decline, almost as rapid as the increase that we have experienced. But we cannot let our guard down now. We are in a very challenging time in our hospitals. We need to look for a long-term solution, and I just want to note that. Look, we are looking forward to the days when this becomes an endemic situation rather than a pandemic situation. A day that we can return to a much more normal status. And yes, we're happy that our restaurants are open. We are extremely happy that our schools are open. We're happy about our economic growth, but we're really looking forward to the days when we can remove some of our requirements. But I can tell you about this, when that day comes, it will still be really healthy for people to get the vaccination. I just cannot stress this enough. The people who are dying today in our hospitals, dozens, every single day, they are dying because they were not vaccinated. And the evidence continues to mount of the importance of this and the efficacy of it. You're maybe 10 times more likely to be hospitalized if you're not vaccinated. You're probably 20 times more likely to die. And here's an important point I want to share with people today. If you get the booster shot, you're 2 to 5 times safer than if you just get the first 2 doses. So we don't know when we're going to get to this endemic situation. But we do know that the ability for this booster to keep you out of the hospital will still be very important. So we hope people continue to get their booster. Tens of thousands of people are continuing to do so. Let's keep that up. That will accelerate the time when we can get into the endemic phase. Some good news in our efforts. Our Say Yes COVID Home Test.org is working. It's now delivered 1.4 million test kits right to your door. It was pretty exciting. I talked to some people who actually got the test kit the morning after we got the website up. So we're really happy about that. More will be coming. Of course, that's dependent on the supply chain. We've got all of them we can order. And we'll look forward to that restoring, increasing supplies when that supply chain opens up. So we remain in a precarious place. We have more work to do. We look forward to continuing our joint efforts. A couple more updates. Fish and Wildlife Commission. We've made 3 appointments. Melanie Rowland from the Methow Valley, Tim Reagan from Anacortes, Dr. John Lemko from Wenatchee. These appointees all bring an understanding of science and the importance of conserving our natural resources. There are people who hunt and fish amongst them, and people enjoy nature in every different way. So I hope the Senate will confirm them in short order. We're looking forward to their service. Transportation, some good hope in this regard. I've been talking to our transportation leaders. I was advised that the chairs have come to largely an agreement as to the amount of revenue that would be available, and that's a significant number. And now we have to have them and others do work to come up with the specific investments that we would make. I think this has every opportunity to be a significant investment. It's going to be a statewide investment of of large state projects that are really important to the whole state. And I'm looking forward to their continued progress. I'm helping them to every way that I can. We'll have a new Supreme Court justice. Justice Breyer's had an incredible career in the Supreme Court. And I think President Biden's on the right track as far as his potential nominee. We'll look forward to that happening as soon as possible. I'm going to close by offering warm wishes to Senator Reuven Carlisle. He announced that he won't be seeking a re-election, but he's got a lot of work to do this year on climate change bills, and I know he's working real hard on them. He has been a climate champion in our legislature. He is known in many state legislatures beyond ours because he's worked with other state legislators to lead, and that's one of the reasons Washington State is known as a leader in climate change policy. So he worked hard, and we know he's going to work hard the next few weeks to continue that progress. But we're going to miss him in the Senate chamber. With that, you may fire when ready, Gridley.
Up first, we'll go to Rachel with AP. Go ahead, Rachel.
I am having some technical difficulties here. Can you all hear me?
Yes, we can hear you.
Okay, great. Governor, speaking of the bills that you just signed, other than the bill that increases the groups who can seek an exemption, what, if any, other changes would you like to see made to the underlying law? And then how can you guarantee that this program won't be delayed again in 2023?
Well, the ones that I seek are the ones that I just implemented, and they're in the bill. I think the two that would be most interested to the public are the one that gives people a pro rata benefit if they're retiring within the next 10 years. The original bill did not give them a benefit, and this restores a lot of fairness by giving them a pro rata benefit in a way that I think is very well calibrated by the legislature. Second, there was a concern about people who are outside of the jurisdiction of Washington, and there was a solution for that crafted as well. I think those are the two most important improvements. There are a variety of others, and I can give you an outside brief on that. But listen, I'm just really happy. This is, first of the kind in the United States. And our state is led in so many different ways. And here's another way we have led to help our people have healthy lives, to live in dignity, most frequently in their own homes, where this can make the difference of living a semi-independent or independent life or not being able to have that dignified existence. This is a huge step forward for Washingtonians in their personal lives. And it is simple, it is not just people who are senior citizens. As I told the story of Danielle and Asotin, this can happen to any of us at any moment. And now we all have this added measure of protection of our dignity. And we've led the country. As far as I think it's like many things, you refine things as you go along. These are really important improvements that were made. I don't see any rocky road ahead of us in that regard. And there is a task force, that will look at any other particular improvements, but I haven't seen any that I think could be showstoppers. So I feel very confident about this taking off and flying.
Next, we will go to Joe with the Seattle Times. Go ahead, Joe.
Governor, two questions. Would you support extending WellCare's benefits to people who will pay into the system but eventually move somewhere else to retire, number one? Number two, lawmakers are exploring possible way to curb your executive authority. There's a bill by Emily Randall. There's some bills by other lawmakers. What are your thoughts on that, and would you veto a bill if it reached your desk?
Well, listen, as I indicated, there may be some further ideas that we can consider in the long-term care bill. If we do make changes of any nature, you have to make sure they're actuarially sound. So those are things that may be worth consideration. I can't give you a yes or no. It depends on the particulars of how they were proposed. On the other bill you referenced, I'm not sure it's really necessary because the legislature already has opportunities to make decisions during the last 2 years. But I'm just not very excited about this because the legislature has embraced what we're doing. We've been working in partnership with the legislature for 2 years. And so they have been with us. So I don't think that there's some big threat that it will remove the good decisions that we've been made. So I really am not excited about it, because I think we will continue on this path of working together to make good decisions. And these decisions, and I think the reason the legislature over 700 days have acted in concert with us, they have actually confirmed, I think it's 26 of my orders, and 42 times we've been challenged in court, and we've won 42 times. And I think the legislature, the reason we've been together on this is that they recognize we have saved lives. We might have lost 17,000 more lives had we not acted together. So I don't think there's a particular threat here. I think we'll continue on the straight and narrow in the state of Washington.
Up next, we'll go to Laurel with the spokesman review. Go ahead, Laurel.
Hey, Governor. Similar to the rest of the state, COVID numbers are spiking in Department of Corrections facilities, and I've heard from a lot of inmates that the situation is just as bad or worse as last year in terms of isolation, lockdowns, food service, and in part because so many staff are currently out sick with COVID. So I'm wondering if you can talk a bit about what the state is doing to try to slow the spread among these facilities. Specifically, are you considering bringing in the National Guard to help with staffing shortages or early releasing some inmates like you did in 2020?
Well, the department's doing everything it can with ways to have as much social distancing as possible. And that becomes difficult on times because people can't congregate like they like to, and that becomes of some, angst amongst the inmate or the people in custody. So they're doing everything they can in masking. And one of the things we're doing is make sure the vaccine is available to the people in custody. Now, unfortunately, many of them are not getting vaccinated, and it is frustrating if the people in custody complain about this situation, but won't take care of their own health by getting vaccinated. And unfortunately, that is the situation by many of the people in custody. So that's one of the things we're doing to make sure that that's available. We have extensive testing of our personnel to reduce the bringing the virus into the centers, and that will continue. We don't have immediate plans for other things like early release, in part because we do believe that it is likely that we will see a relatively rapid decline in cases in the relatively near future. Now, it's like everything else in COVID, there is no guarantees. But we think there's good evidence that we will see a quite rapid decline in numbers to take some of the pressure in the next several weeks off of our institutions, including our hospitals. So we're going to continue these efforts.
Next question comes from Austin with Northwest News Network. Go ahead, Austin.
Oh, thank you. Hi, Governor. To my knowledge, nobody from your administration has commented yet on the escape yesterday from Echo Glen involving 5 youth. Apparently, they assaulted staff, stole a state vehicle. One of them was a 15-year-old boy who had been convicted of murder and has now been captured, but as far as I know, the other 4 have not. The union that represents employees out there says they don't know the full details of what happened yet, but they do know that, this is quoting, that the failure to provide adequate training and staffing and ultimately funding is a recipe for disaster. And that union is calling on policymakers to invest in state institutions. Can you comment on this incident and on the staffing and funding situation in facilities like this?
Well, I can tell you what I know. I know these are juvenile rehabilitation centers. They're not prisons. They're run under the juvenile system, which is different, obviously, than the adult correctional system. I know that there is much not known, including by these unions right now, as to what actually happened. So I think reaching precipitous decisions is way too early to make assertions that this had anything to do with staffing levels or it had anything to do with training. So I think that's really premature. I'm always willing to listen to ways to improve our system. But it is way jumping the gun to reach some conclusion about that. I've done some just preliminary inquiry. There's an incident that's been reported that a gate was not functioning. These juveniles apparently drove out. This gate apparently had nothing to do with this. This is a gate that opens up as soon as you drive up to the gate. So if the gate had been there, it wouldn't have made any difference. The gate just would have opened up. It's not built there for a security purpose. You need a key to get in, but you don't need a key to get out. So it appears at the moment that had nothing to do with it. And unfortunately, I think when something like this happens, people jump on it to try to advance their agenda. So no, I don't think it's appropriate to reach a conclusion that they've suggested. And we will get to the bottom of it. There is a critical incident report system the department will use to figure out what happened here and figure out what we could do to prevent it, if anything. And we'll get to the bottom of that, and that'll be a public, you'll certainly know about that at the conclusion of that process. And I want to thank the law enforcement folks for rapidly recapturing one of these juveniles. I know they're working real hard on this. I want to thank them for it, including the King County Sheriffs.
Up next, we'll go to Jerry with the Everett Herald. Go ahead, Jerry.
Thank you, Governor, for taking my question. Back to the COVID and the hospitals, one other aspect they're dealing with these days is nurses are leaving to take higher paying jobs as contract nurses, or they're called travel nurses, move around the state. And we're hearing hospitals are having trouble. It's not sustainable for them to rely on these expensive short-term positions. Should the state be looking into any kind of response or solution, maybe a cap on how much contract nurses can be paid?
No, I don't think that's the best solution. The best solution is to produce more nurses that are available for our hospitals. And we are working on that. We need more nurses. It's pretty simple. We needed more nurses before COVID. So we are exploring things to try to help people go into the profession, including in my budget, a budget item that would invest millions in trying to make it more possible for hospitals to take nurses in their residency program so that they can get into the profession. So that's the solution to this problem, is to give more people an opportunity to get these professional skills. And we ought to do that as fast as humanly possible. We are on both ends of this challenge. So we're using traveling nurses and therefore competing against ourselves. So the solution is more nurses, and we're working on that.
Next question comes from Shauna with McClatchy. Go ahead, Shauna.
Good afternoon, Governor. My question also relates to kind of hospitals and the COVID response. So last week there was a public hearing on House Bill 1868, and a lot of hospital CEOs testified against this bill. The bill would have provided more improvements to worker safety, staffing needs, and breaks. So I'm wondering what your thoughts are for all these hospital CEOs kind of speaking out and testifying against this, especially during a pandemic.
Well, what I think is you can't expect nurses to work 23 and a half hours a day. Not only is it unfair to them, it's unsafe. You know, your ability to be safe deteriorates after a certain period of time. And we are asking nurses and other staff members to do extraordinary things during COVID. So I am sensitive and appreciative of the goal to try to prevent the nursing staff from suffering this sometimes dangerous staffing they've had to have. But I'm also understanding that we need more nurses to solve this problem, because if you reduce hours, you need more nurses. So we need to find that solution as well. So I haven't looked at the specific legislation, but I'm generally thinking that it's wise to consider heading in this direction.
Up next, we'll go to Drew with King 5. Go ahead, Drew.
Good afternoon, Governor. The ESD is concerned about the Paid Family Leave Act running out of funds in March. Can you explain how this has happened and what's being done to make sure that those checks continue to go out here this spring?
Yes, it's very quite simple. COVID happened. We just started a new program. And of course, in any new program, trying to do the actuarial analysis is difficult. And then boom, you get hit by this COVID pandemic where people rush to leave to use this incredibly important benefit. And they have. And this has been a very successful program. The ESD has processed 351,000 claims already. They've paid $1.5 billion in benefits to families. They've covered 35 million hours of leave. This has been a really successful program. And like many things, it's best in the nation. In fact, our state was given the National Association of State Workforce Agencies the annual award for the best rollout of a paid family leave program last year, or the year before last. So it's been really successful, and this challenge has been an indication of success. People have enjoyed this program and they're using it. So what we need to do is make sure, obviously, that it is actuarially sound. I've talked to legislators about what we need to do that. I'm confident that we will do that. It is not anticipated, at least in my book, that when you have a giant pandemic with thousands of people using this program, that you won't have to jigger some of the actuarial numbers. So I presumably we will figure out a way to do that. I'm confident we'll have a success there.
Next question comes from Keith with Como. Go ahead, Keith.
Yeah, Governor, given the fact we're 2 years into this pandemic, and you say we can't put down our guard, how are you keeping yourself energized personally, and what can you do to actually help other people to stay energized in the face of all of this COVID fatigue?
Well, I take my energy from these press conferences. I look at it as kind of bullfighting, and I take these little picadors and, no, I'm just kidding about that. Well, I'm just, I'm human. I have the same challenges as everybody has had on this, but I am inspired, and this is not a cliche, it's true, by great work that Washingtonians are doing every day. And I know we have a lot to be proud of here. We have led the nation in our response to this. We have saved perhaps more, almost as more lives than any other state in the United States because of what we've done. That's a daily inspiration to me. And I guess I thrive on a challenge too, just by nature. And we've had big challenges here. So I feel as energetic as the day COVID started. And I also feel hopeful. And let me share this. It's dangerous to have hope during COVID, but I have it. Because I do think the nature of the Omicron virus, when it started, I thought there was a fair chance that it would drive out Delta, which is a horrendous virus, with one that might be more transmittable, but one that doesn't take as many lives. And that's exactly what has happened. Omicron has driven out Delta. It's replaced it by a less lethal virus. And that's a blessing. Now, more people get the illness, mild illness, but less people have to be hospitalized and die. That's a good thing. And we now have the tools to be safe. We have the tools. If you want to be safe in Washington State, we have the tools. Get the vaccination. And so we have the tools to do that. And I think that in the relatively near term, we may be in a place to have a much more normal endemic approach to what will be with us for a long period of time. And I'm looking forward to that day. So I'm hopeful and optimistic about where we're heading on this.
Next question comes from Joey with Puget Sound Business Journal. Go ahead, Joey.
Hi, Governor. A few weeks ago, you kept the door open on issuing a vaccine mandate of your own after following the Supreme Court ruling saying it didn't inhibit your ability to do so. Employers in the state, some of them have been waiting for government leadership on this, not wanting to, as you said a few weeks ago, given the tight labor market, not wanting to stand out on their own. Have you given any more thought on what you might do and, addressing the frustration among some employers of having to plan for a mandate one day and then the next day unclear what the future might hold?
Well, the same position I was when I talked to you about this a week or two ago. There has not been a change in our thinking about this. There's no imminent decision in that regard. I can't ever rule things out, but there's no imminent decision heading in that direction. But what there is just such a pain in my heart about the people who aren't getting vaccinated right now. And when I see these stories about these nurses that have to explain to people they're going to die because they didn't get vaccinated, how painful that is to the nurse and the family, it just gets me. And so I continue to share a sense of urgency for people to get this vaccination. I do believe these numbers are going to come down. It's highly likely they'll come down rapidly. But people still will be getting this disease that can still take your life, even though the numbers get low. So what I would say is we're going to continue our efforts to share that message with Washingtonians. I hope they listen to it.
Up next, we'll go to Caitlin with KXY. Go ahead, Caitlin.
Hi, Governor. Going back to the Washington Cares one, why not make it optional? Some families can't afford to pay rent right now, so they can't afford to have more money taken out of their paycheck. So why not make it optional at this point?
Because it doesn't work. It just doesn't work. You know, you can't make a protective policy like this built on rainbows and lollipops. You have to have a revenue stream to make it available to everyone. So saying you want it voluntary means you don't want a functioning program, because you cannot make a functioning program that's voluntary. It's like saying, why don't we make the United States federal government and the Pentagon voluntarily financed? Because it doesn't work. And so we all need to put it into the pot. And we all have an opportunity to benefit by it too. We can't for sure know who will, but I think that this strikes the right balance. And it's another stride forward to security for families so that everyone can share in this security. Without this, only a few people are going to share in this security, and that's the simple fact. Now, my beliefs in this is compounded by the enormous economic inequality that we have in our society. It's just mind-boggling how much inequality there is in our society, where people work hard doing the work to keep people alive, but all the money is going to the top, and they can't afford it. So this is a way so that everybody can have a sense of dignity in the state of Washington. I believe that is a value worth building a structure for. And you cannot do that like a bake sale at a PTA. You have to do it with a sound structure to make sure the money's there to get it done.
Next question comes from Melissa with Crosscut. Go ahead, Melissa.
Shoot.
Oh, we can hear you.
We can hear you.
Thank you. Thanks. I have too many tabs open, Governor. Thank you for understanding. I was wondering, it looks as if your missing middle housing bill passed out of a Senate committee today. How optimistic are you feeling about that getting through the full legislature? And can you reiterate again why you think that's a necessary policy for the state?
Well, I think it has a shot. I spoke to the Association of Cities today about this. And the reason it has a great shot is there's two things that have happened fairly recently that makes this more likely. Number one, everybody understands how bad the homelessness crisis is. That's just a fundamental thing that has happened times two in the last 12 months. People know we have to act on this. And the second is people just have this increasing recognition that you cannot be for homelessness unless you're for building housing, and you can't build housing if you have nowhere to build it. And these artificial restrictions now take off sometimes 80, 85% of the land where you can build middle housing, housing for teachers, firefighters, truck drivers, housing for our children who otherwise can't afford a place to live in a city. So there's just an increasing recognition that we have to take action in this regard. And I've proposed a fairly well-calibrated way to go about that doing. By the way, I want to note too, this is important not just from the issue of homelessness. It is important for the generational inequity that we now are experiencing, that our kids and grandkids can't find a place to live. They can't afford rent in a city, can't buy a house in a city. I look at this as we ought to pass something down to our kids and grandkids, and we can't do that if we can't build middle housing that is affordable to middle-class people in these cities. It simply cannot done and will not be done. So I think there's an increasing awareness of that, so I think we got a great shot.
We will check on a few others to see if they had any follow-ups. Rachel, did you have any follow-up questions? Maybe not. Okay, we can try Joe with the Seattle Times. Did you have anything to follow up, Joe?
No, I'm fine, thank you.
Okay, and Jerry Cornfield with the Everett Herald. Let me find you and see if you had a follow-up.
Yeah, please. Thank you. You mentioned your optimism with the middle housing bill, but another bill of yours, the one aimed at salmon recovery, the Lorraine Loomis Act, that one does appear to have a little trouble in the House. It's had a couple of hearings. At this moment, it hasn't been scheduled for a vote. The Senate hasn't had a hearing on its version. What's your understanding of the issues that are holding up that bill? What are you doing to try to decongest, move it along?
Well, I don't think there's cause for optimism on that bill. It is currently drafted because there is opposition to it on the ability to actually save salmon by making sure the water is cool enough. And there's some opposition to the bill because not enough people have embraced that mission statement yet. But I do think there's an opportunity for a revised provision that can do some of the work we can do to help, such as mapping the areas where it makes most sense to restore habitat along the riverbeds, of having a further conversation about measures to move forward, and I hope some progress can be made. No, I'm not sure I mentioned, I think Austin asked me a question about the Echo Glen case. I wanted to make sure I did tell you, there will be a critical incident report of this. The department is already working on this. Of course, the first thing they need to do for the first few hours, they had to make sure the institution was secure. So they had to do that before they held a press conference. But there will be a thorough investigation of the incidents of this. We'll find out what happened. We'll find out what could have been done to prevent it, if anything. But in the interim, let me speak forcefully that people should not be jumping to conclusions and using it for political purposes. That is more than annoying. It is unhelpful. So we'll get to the bottom of this and things will improve. With that, please be well. Take care.